Good afternoon, everyone. Thanks so much for joining us this afternoon. I know we've got quite a few people here trying to join still. We're going to give them just a quick minute to try and hop on. All right, and we'll get started here. We'll wait for everybody to kind of hop on and join us. But good afternoon, everyone. My name is Laura Drayton. I am the Policy and Planning Engagement Specialist, and I will kick us off this afternoon. So I just wanted to go over some housekeeping here just to get us started. Here. First of all, we just wanted to welcome you to the Social Determinants Health Partner webinar. We appreciate you joining us this afternoon. If we could start off with some introductions, we'd love to have everybody just put their name and title in the chat and maybe the organization that you're coming from. And then we also ask that you please keep your microphone muted when you're not speaking. And if you could please keep your cameras off just for now to cut down on the bandwidth.
Dog downstairs.
Oh boy.
Oh goodness, sorry about that. My computer got muted. I don't know where I got cut off. Sorry about that. But I just wanted to welcome everybody to this meeting. Sorry about the technical trouble there. I got muted. But just a quick overview of the agenda. Today, we're going to start off with an overview of the Social Determinants of Health strategy. Then we're going to go into a roundtable discussion of housing stability and food security. We've got a great panel for that today, so we're pretty excited about that. And then we have a health equity focus area overview. Then we're going to go into implementation and next steps. And finally, we have some time for questions and answers at the end as well. And I don't know if I got cut off prior to this slide. Let me go back here. Just to make sure that everybody kind of got this slide. I know we've got a lot of new people joining and my got cut off there. But just a quick overview again of housekeeping. Please share your name and title in the chat. Please keep your microphone muted and your cameras off while you're not speaking, just to help us cut down on bandwidth and distractions. We'd love to have you use the chat to ask any questions. We'll have some time set aside for questions and answers. And we'll also be addressing a lot of these after if we don't have time to get to them. And then during the question session, we'd appreciate if you raise your hand if you'd like to speak so that we can get to some of those questions that might not be in the chat. And just a notice that this meeting is being recorded. So with that, I just went over the agenda and I'm going to hand it off to Nina.
All right, thank you, Laura, and welcome everyone. So we had over 300 people register for this. This is great. This is so exciting. I just want to remind folks to keep your camera off just in case we have any bandwidth issues. I may keep mine off for a portion because I'm hearing some distortion in video or audio. But again, this is so exciting to have you all here, and there's so much to cover. I appreciate everyone's contribution so far to this strategy and just excited to share where we are. So just kind of diving in and giving some background. I know this isn't new to you all, social determinants of health, thinking about all of those environmental and social impacts that influence health outcomes. You know, just early this morning, I was in a meeting where we were talking about desperate outcomes, and you hear all these statistics about this vulnerable population, that vulnerable population, and it's really disheartening. What excites me about this work is that we're moving upstream. We're looking at those social factors that influence health outcomes so that we're not buried by the data. You know, we're using the data to guide where we move, but again, we're using it as an asset and not something that, again, we have to reflect on and hear the same statistics over and over again. So just one of the reasons why I'm really excited about the work that we're doing in this space and really focusing on upstream prevention. So again, just setting the foundation for this conversation and our strategy. Social determinants of health are everything that influence health outcomes from the moment you wake up to the moment that you go to sleep. And so thinking about the access that you have, who you're born to, the environment that you live in, all of those factors. And what we're going to be doing with this strategy is really allowing us to think about those things and how we can have policy and funding that supports innovative solutions, community-driven solutions, and just making sure, again, that we're providing those upstream, solutions to the work that we do in this space. Next slide, please. Thank you. Building bridges for collaboration. So there is a lot to be learned. As you think about, the pandemic, we've all, participated or heard a lot in terms of, desperate outcomes as it relates to racial disparities at the height of the COVID pandemic. And again, there was a lot of key recommendations that were helpful in making sure that we were reaching vulnerable populations and we were really targeting and being responsive in getting resources out. And so in putting this strategy together, we wanted to acknowledge that there's existing infrastructure out there and we're not looking to recreate the wheel. We are building on those key recommendations, pulling all of this information together as we think about a strategy that really stresses collaboration for a greater impact. So again, as you review the strategy, there are key recommendations from the COVID Racial Disparities Task Force, the Poverty Task Force. The Michigan State Housing Plan will be releasing their report soon. There was a lot of collaboration throughout the process as we were developing our strategy and they were putting together their plan. Again, really wanting to strengthen those opportunities for us to collaborate and think about holistic approaches. Think about, again, those intersection between the domains and how we can really support community as it relates to housing and all of the other social and environmental impacts that contribute to health outcomes. Just want to acknowledge again, if you can go back a slide, I apologize, that, this work is successful and will be successful based on the collaboration and the support that we have from you all. And so there will be a lot of opportunities for collaboration and engagement going forward, but just want to acknowledge, the folks that were at the table during the brainstorming sessions as we put this together. We had quite a few state agency partners, local and community partners, healthcare organizations. It was really a collaborative process. And so I appreciate that and just want to know that that is really the foundation of where we come from, is making sure that we build upon the existing infrastructure here, look for opportunities for improvement and better collaborate. Next slide, please. All right, so where did we start? So if you think about our social determinants of health strategy, there was some foundational work done in 2020 and 2021. There were MDHHS leaders that put together a strategy that really stressed community-driven solutions and how we can be supportive to that. There were a number of things and initiatives and activities that were included within this work. What we're doing in 2022 is refining that and looking at how we can narrow that scope so that we have a policy lens. And as we think about how we can be impactful in the policies that we have statewide so that they're supportive, to community efforts, and also how we're allocating resources. So that's really the lens of what you should be looking at our strategy from, is really in 2022, we're looking at refinement and how we can better support innovative solutions and really allowing us to better align in our work. As we move forward, we're really marching towards holistic approaches. That means thinking beyond one domain, knowing that, again, transportation is something that we need to support, and making sure that people have access to transportation, for example, but thinking more holistically, all of these things together, transportation, education, all of this work is interconnected. And so as we think about putting together initiatives, as we think about braiding our resources in regards to funding, we really want to have that holistic approach of looking at the entire scope of things and how they impact health outcomes, and how we could have supportive policy for this. And that will allow us to continue to march towards innovation, and again, gets us to a space where we're being more effective with our state resources and better supporting our community partners. Next slide. So 2022. We have a narrow focus, but I don't want you to think that that means that the work within our department will not continue. There are so many different program areas within the Michigan Department of Health and Human Services that touch on social determinants of health. That work will continue. Within this strategy, it allows us to have this narrow scope so that we can look with a policy lens, look for opportunities for improvement, alignment, and innovation. And so as you think about 2022, here are the focus areas: health equity, housing stability, and food security. And I will note, within these domains or focus areas, it's huge. There's so much that can be done. And so we've even done another job of really prioritizing how we can focus within housing stability and food security. And I'll have the team really give you an overview of that as we progress through this presentation. Next slide. So how do we get here? So again, I mentioned that, again, we were able to really build upon some initial work done by leadership within the department. And then we also examined what were some of those lessons learned from COVID. As I mentioned before, we were able to deploy resources as it relates to food and supporting housing and so many other social factors. We were really wanting to look at how we could sustain those efforts. What were those lessons learned? What were those best practices, so that we can continue to be impactful in those spaces? But then also reflecting on, again, what are some key recommendations and making sure that we're reaching the most vulnerable populations? So that's where we operated in that space of really taking that assessment approach. And then again, looking for opportunities for alignment. I mentioned there's so many different programs across the Michigan Department of Health and Human Services, as well as our other state agency partners. We want to create a space so that program areas can come together and ensure that resources are bundled, so that when a community resident needs something, they have access to all of this information. That means cross collaboration, cross marketing, again, creating cross-sector initiatives that allow for us to be more impactful. So that was one of the things that we did, was just create a space for state agency partners to come together and share what programs they have, look for those gaps, and look at how other programs may be able to fill in those gaps or identify opportunities to improve upon what we're doing. We will continue to look for opportunities for alignment within the state and with our public and private partners outside the state. And then also, again, like I can't stress enough, I'm excited about when we get to a space of innovation where we're thinking beyond, economic development and thinking about how that impacts health. So again, applying that health and equity lens to everything that we do at the state level and everything that we do, effectively across the state. So this is really the key of showing of how we're taking this approach and getting to, key areas of improvement, alignment, and innovation. So before I hand it off, I just want to tell you again, we're excited to share this strategy. We have really developed an agenda that will allow us to be more interactive. We have roundtable discussions, opportunity for question and answer periods. We really want to hear from you. Reflect on what you were able to read from the strategy that we attached to the appointment, enter that information in the chat. this is an opportunity for you to give us that baseline information or questions that you have, share those questions. We really want this to be more of a discussion as opposed to us speaking at you for an hour and a half. So with that being said, I'm going to hand it over to Molly and David, who will introduce themselves as well as our esteemed panel regarding food and housing.
Thanks so much, Nina. I'll turn my camera on briefly to introduce myself. Hi, everybody. Molly Welch-Marahar. I manage our strategic alignment and engagement section. I work under Nina in the Office of Policy and Planning, and I oversee our work on housing stability within our social determinant strategy. Solutions to housing stability require tailored interventions that approach individuals holistically. So as you can see, in 2022, we've broken it into 3 priority areas. So in the first priority area, we're talking about supporting populations made vulnerable to housing instability. And that category is broad and far-reaching, but we have a particular emphasis, at least in the near term, on justice-involved individuals and returning citizens, individuals with substance use disorder and other behavioral or physical disabilities, older adults, homeless youth and youth transitioning from foster care, immigrants and refugees, and then also addressing racial inequities and disparities in housing access. In holistic approaches to housing, we're really looking at ways to promote streamlined access to resources to address safety hazards and mitigate the impacts of environmental injustice in homes across our state. And then in the third category, addressing housing access for people experiencing homelessness, we're putting renewed emphasis on existing MDHHS work to improve housing access while infusing new resources and technology to increase capacity and support more effective systems. So I'm going to hand it off to my colleague, David, to introduce himself and talk about his area.
Good afternoon, everyone. I'll turn my camera on just for the introduction as well. My name is David Jones. I'm a senior policy analyst here at DHHS. My specific area is food security. I'm going to give you a high-level overview of our food security priorities, and then we'll move into our roundtable discussion. So within the food security priorities, we've identified 3 major categories of work, those being supporting those vulnerable to food insecurity, streamlining processes, and alignment on key food security reforms. In order to make Michigan as a whole better, stronger, and healthier, we have to capture information on food insecurity statewide to aid in policy planning and decision-making. Focusing on the individual and their community needs is one way to increase awareness and utilization of food and nutrition programs for all people in the state of Michigan. We also want to make sure that we continue to be innovative and inventive in the food security area, which will allow us for collaborations between state, county, and local governments, and will help benefit efforts to increase access to safe, affordable, and healthy food options. We want to make sure that we express our community partners, our local state government partners, are keys to what we're doing in the food security area. Without the access to those partners, we don't have the ability to go into every local community, every state community, and see exactly what the needs are. So it's very beneficial for us when you attend our meetings. We have a food security meeting coming up in May. We have a housing meeting coming up this month in April. It's very beneficial for us when you guys attend those meetings and give us your ideas, give us your questions, your comments, because it helps us in the long run become more educated in what each community needs. In our next slide, we're going to have a panelist of a couple people from the food area and the housing area. We've realized that without stable housing, you can't have food security. And without food security, you don't really have stable housing. So we've brought together a group of people who are going to introduce themselves coming up here shortly. We have a couple questions we're going to ask them, and then we're going to get into some questions from you guys. Again, we want to express our gratitude and our thankfulness for you guys submitting questions to us. It really helps us, and we want this to be as interactive and as educational for each side as possible. So if our panelists could turn their cameras on for this part, and if everybody else could turn their cameras off for me, make sure your mics are muted. We're going to go ahead and get started with the roundtable discussion. So to start, we're going to have each of our panelists introduce themselves shortly. We're going to start with Janae Moore.
Hello, my name is Janae Moore. I'm the Food Access Public Health Consultant. I sit in the Division of Chronic Disease Prevention.
Next up is Christina Herring.
Hi, I'm Christina Herring Johnson. I am the Michigan WIC Director, and we are over the state's nutrition program and women, infants, and children. And I have also one of my employees with me today, Myra Lee Fowler.
Thank
If you
you,
would like to
Christina.
introduce yourself, thank you.
Thank you, Christina. I'm Myra Lee Fowler, and I am the WIC's Social Determinants of Health Policy Analyst leading the DEI and racial equity work for WIC in Michigan.
Next up is Tiffany King.
Good afternoon, everyone. Tiffany King with the Michigan State Housing Development Authority. I am the Equity and Inclusion Officer overseeing our Equity Engagement Office. And my focus is working with staff to address barriers to housing and leading Michigan's effort to create its first statewide housing plan.
Thank you. Next up might be my favorite name in state government to say, Paula Kaiser Van Dam.
Thank you. Hello, good morning, good afternoon. Paula Kaiser Van Dam. I'm the Director of the Bureau of Community Services at MDHHS, and in that role, I oversee the department's work around housing and homelessness, domestic and sexual violence, and other victim service work, the funding we provide to community action agencies across the state, and our Pathways to Potential program, and our MyBridges portal development and community partnerships. Glad to be here today. Thank you.
Thank you. And last but not least is one of the people who's responsible for me having this role. So if you have any issues, you take it up with Ms. Steph White.
Oh, I was having a hard time coming off of mute. You're lucky. I am Steph White. I'm the Cross Enrollment Coordinator. I work in the Opportunity Division of the Department of Health and Human Services, and my role is to work among the various programs, both within the Department of Health and between the Department of Health and other departments in state government to find ways to connect our constituents with all the support programs for which they qualify, to break down some of those silos and do some of that cross-sector initiatives that we were discussing earlier. So nice to meet you all.
Thank you all for joining us. Just as a quick aside, how this is going to work, we're going to, Molly, my partner, is going to ask the panelists the first question. They're each going to have an opportunity to answer, but realistically, we want is good conversation. We want to make sure that we are engaged and we may have a good conversation for our attendees. So Molly, I'll hand it off to you.
Thanks so much, David. And the question that we're going to ask is actually one that we received as part of the registration process. That question is, which social determinants of health are most impactful and more consequential for racial and ethnic minority groups? And I think we're going to go in the same order that you introduced yourself. So Janae, did you want to respond first, please?
Sure. I mean, I think it's hard to pick a social determinants of health, right? They all kind of work together. We know that in public health that your health outcomes, your life expectancy, really can just be boiled down to the zip code that you are born and raised in, right? And really what that means is the environment in which you live in, those are the social determinants of health are really what determine your outcomes. I think, one of the points to make is we talk about the social determinants of health as if they're negative, right? But they're actually neutral, right? Like if you have access to all of them, pick a city like Ann Arbor. I picked it because I'm here right now and it's great, but they have the social determinants of health. It's a great city to live in, has great health outcomes, has great access. You could cross over, go down Washington, go into Ipsy, and completely different health outcomes, completely different access. Also has a higher Black population, right? So, understanding that it's the lack of access to all of these social determinants of health that really causes the disproportionate outcomes for our racial and ethnic populations in this state.
And I guess I can go next if we're just doing it in order. I really don't have much to add with based on what Janae said. I think one, I just completely support her response. I would say in particular with WIC, I do agree from the work that we're doing, from research, engaging with our clients. I mean, there's really no in particular factor that stands out alone. I think just one thing that's important as we do this work is to, once again, really understand when we're talking about social determinants of health in alignment with race and ethnicity, that we make sure that we do not box in minority populations based on race. So when we say people of color, it's really important, especially around research and thinking about health outcomes and disparities, that we really give individual communities their own grace and attention to addressing their needs. So I think one thing would just be about also not collapsing for convenience or checking the box when you're thinking of people of color, but really being sensitive to addressing needs based on race and other social determinants of health that are applicable to that specific community, race and ethnicity.
Thanks so much, Myra. Apologies, I'm having a hard time reliably unmuting my mic. But Christina, I'd like to pass it to you and see what you have to add.
Okay, well, Myra works for me and she's my social determinants of health specialist, but I would totally agree with both her and Janae. One of the things that we have been doing is Myra's role is very specific to looking at the health outcomes. And so we work hand in hand to make sure that we are making sure that we're very specific and attentive to making sure that we're not, again, like she said, just checking a box, making sure that we are looking at the outcomes of all areas, nationalities, environments, and our food guide specific to make sure that we are covering all ethnicities. So I am in total agreement with Myra and what Janae has already added.
Thanks so much, Christina. Tiffany, did you want to share your thoughts on the question of which social determinants are most impactful?
Yeah, yeah, they all interrelate, and so they all have an important place. I surely, working for the housing authority, see the impact on housing and quality housing when it comes to health, access to opportunities, when it comes to jobs, and also education. And with that being said, it's also the lack of housing that's available. So working on the statewide housing plan, what we're seeing is that there's a lack of quality housing that's affordable across the state. We're looking at existing housing structures that need to really be brought up to code with lead issues. And so, it's the housing stock itself and access to it, and then it's discrimination practices and what is taking place to limit individuals to access those opportunities. And so there's just so much work to be done. We just finished a housing survey a couple months ago, and what was alarming and then stood out that many people didn't know where to go for housing information. A lot of individuals are, of course, still being discriminated or feel that they're being discriminated. Some of the top areas where individuals are just as involved, or they are people with disabilities, along with many other factors. So there's surely a lot to be done in this space. And I think it's more than just providing resources, is really figuring out what are the root causes, some of the systemic discrimination practices that have taken place that have placed us in this situation, and really figuring out how to overcome those practices.
I can jump in, Molly. I know you've been having trouble with muting, so.
Thank you.
I'll just build off of what Tiffany said. I think, you know, obviously, I also bring a bit of a housing and homelessness lens, since that's one of the buckets that I help oversee for the department. And I do think that, and I also was helped to oversee our community health innovation regions, which was very much focused around connecting folks to, you know, addressing the social determinants in the 5 community health innovation regions. But what I would say is I think that housing one is really the foundational one, because without it, I think it's really hard to focus on things like food, health, transportation, other kinds of things like that. So I do think that, you know, as a foundational you know, social determinant, I think housing is the one that is the most, you know, critical. Without it, it's really hard, I think, to, without that stability to, you know, address and work on the other ones.
Thanks so much, Paula. And staff, you're up. You're our last panelist on this question. Staff, you're muted. Are you having trouble unmuting as well?
Mhm.
Oh, here you go. Oh, you're muted again.
Okay, sorry about that. So I'm gonna have to make a plug for food, since everybody else has been on the housing bandwagon. You know, we know intuitively, and we know when we visit the doctor, that food has such a huge impact on our physical health. But it's more than that. I mean, many of you, I'm sure, know this, that food is intimately tied to our mental and emotional health. And when we think about the social stresses, particularly on people of color, in society, in communities where anyone is, when you're not part of the majority culture, if you're part of the minority culture, you have excess social stressors, right? And without sufficient food, not just healthy food, but also enough quantity of food, reliable, and knowing that you have the security of a reliable source of food, you knowing when and where your next meals are coming from, and that they're always going to be there, you know, that adds a level of social stress that can be interpreted as being, you know, hostile. People get interpreted because of their mental and emotional stress as being antisocial, right? And then that impacts so many other aspects of our lives. And so food and housing, obviously, I would say, are the 2 core elements of SDOH that we have to focus on. And so much of the work that we've been doing across the Department of Health has been on ways, thinking about how we make sure everybody has access to food as best as we can. So that's my plug.
So yeah, so the reason why I said you can't divorce them, or that one is not important, is because they're interplay in how
Right.
we design our communities and our places. Like, I would never put housing above food, or food above housing, right? Like, so if you ask me what's the main issue, it's racism, right? And racism is historical, but has set up our country in such a way that we are highly segregated. Michigan is one of the most segregated states in the country. Right, so populations, racial ethnic minorities, are grouped together, separate and off to the side, which means their access to food and housing is now grouped together and off in these various pockets, which means they constantly have interactions, which is something we have to think about. I'll give you an example. A community designed a whole new housing plan. They designed a whole city, or what I would say, a town area, a housing plan, making sure they had transportation. They didn't put a single grocery store in the town limits. It never occurred to them, right? And now you have this new housing, you have all these, there's no place to get food in a reasonable distance. It just, you know, planning. And from my perspective in the food work, I'm always trying to think about all those things at once, right? So if I'm going to do food security, if I'm going to work in food access and food security, I need to figure out, is there transportation for their food? Do they have housing to, but is that housing adequate to store food? Do they have a refrigerator? Do they have a place to cook it? If we're giving out canned goods, do they have a can opener? Can they afford a can opener, right? It has to be a holistic approach. Otherwise we'll forget something. And then we'll figure out later that they can't even they can't really live the life we thought they could live in the housing, and they can't cook the food we gave them. We need to have solutions that think about both together instead of separating them out, so that we actually improve their social determinants of health, right? We want to improve the conditions in which they're living in. And that's how I contextualize the work, I guess.
Mhm. Yeah, and I think it's one of the strengths of this overall approach that policy and planning has been putting together, is thinking about how tightly all of these things are interwoven. Yeah, well said.
I want to thank each of our panelists. You guys are amazing. Thank you for doing this for us and with us. Again, our main goal is to engage our community partners, engage our community, and make sure that we're meeting people where they need to be met. We don't have all the answers. The only way to get to the answers is to get through the problems and to get through the roots of the problems. And we do that by engaging our community members. That's why next up, we're going to hand it over to Brad Barron for a Q&A session with some of the questions that came up through the registration process. Again, thank you to our panelists, each and every one of you. We greatly appreciate it. And thank you to our participants who submitted questions for this next part.
Thanks, David. So we did get some questions coming in, and this is going to be either for the panelists or for others of the team. So I've received several that have also come in on the chat. If for some reason we're not able to cover your question today, don't worry. We are capturing all of these questions that were either submitted by email as well as in the chat, and you'll see those questions answered in a frequently asked questions related document in the future. So to start things off, one of the questions we got in the chat was, are there any programs that can help undocumented parents of citizen children pay for rent when short of funds? So I don't know if that would be more geared towards Tiffany or Paula, but I thought that would be most appropriate covered from a housing perspective.
I don't have an answer to that, but that's surely something we can respond to in the Q&A fact sheet.
Yeah, the same, Brad. Nothing comes to mind right now for undocumented parents as an eligible program, but would love to take that back to our housing folks here and see if they have something that I'm not currently thinking of.
So let's see. The question that we're starting in is how does the social determinants of health strategy consider access the differing needs between rural and urban Michigan? Sure, one of the panelists wants to start off and take that one first.
Sure. I also wanted to drop in this link to the Michigan Immigrant Law Center. They do help with like housing and payments and those kind of things. They will help you find someone locally. Just a link. I've done stuff with them. For food, it's really about thinking about how those solutions work for that community. One of the things is spatially, it's very different. So a solution that's designed for a compact urban community, like a grocery store, we do corner store initiatives to increase healthy food, that doesn't fit right in a rural space where you have to travel a long distance. So you have to think differently, geographic and spatially. Also culturally, expectations around what a store should look like, what should be in a store. You have to think about that. One of the things I really work on and try to integrate is that what solutions they want, asking them what they want and what they see in their community, and then trying to financially and provide technical assistance to support that. Sometimes they want the exact same thing. Like they're like, we want a Meijer. Somebody get us a Meijer. But other times they really want local solutions, whether it's getting like they previously had, there was a person in a rural area who used to own a grocery store but got knocked out by Walmart, and Walmart has left. This is like a common theme. They want to open that community store again. They want to get that going. They want to, it might be attached to their like downtown rural revival programs. So you try to engage it that way. Other times in Urban Solutions, they say we want a local Black-owned co-op, like in Detroit. So you have to try to support it that way. I think like one of the key things though is asking them first what they think would work, getting some of that community feedback, and then looking into like the literature of food to figure out, well, how can we make that work functionally, and who are the partners that we need at the table to make that happen?
And I'll chime in is in regards to food access. The Michigan WIC program is the 8th largest WIC program in the country. So one of the nice things about us is that we are we're very diverse of area wise. We have over 47 local agencies, and within that 47 is an umbrella of 212 offices where we do have resources where we can have our families go in to be able to receive services. And the nice thing is currently under the pandemic situation, we do offer waivers, so we don't even have to have families be subjected into coming in and bringing their children into an environment where they can actually do the process over the phone. So the nice thing about that is that we do have alternatives, and we are offering multiple different ways of being able to offer nutritional services to our families. And another thing too is that we do offer our process in other areas as far as language barriers. If there's any kind of language barriers, we do offer different language literature as well as interpreters that can assist with the process. So we are doing all that we can to cover our state to the best of our ability, and making sure that no one is left behind or left out, especially during a time of need right now.
And I would just like to add, supporting what Christina said, that one thing that we're proud at Michigan WIC to say is that we actually are currently have been awarded a grant from Tufts University, funded by USDA as well, to work on our Michigan telehealth project. And so we are actually piloting with 10 local agencies across the state, where we'll be able to look in real time the effectiveness of how telemedicine is impacting our clients both in rural and urban areas. So this is actually a 3-year project, which we've launched in January. So this is something between being able to assess, our clients who are high risk, that will have now access to video conferencing to be able to receive nutrition and breastfeeding services.
Thank you. Another question, how do we engage community members to best address the needs of their communities, not using a one-size-fits-all model? Someone that in the panel that wants to kind of jump in first?
I can say just community engagement. I think it's very important that we educate and that we continuously keep them informed of what we have to offer, what our services are, what the requirements are, and just being an active part of our communities. It's one of the things that we've always really tried to do, and we've had some things happen, throughout the pandemic, but with things changing, and it's just a matter of making sure that we continuously educate our partners, have things such as this to be able to talk about what our different programs do and the impacts that they make.
Yeah,
So one of the things, sorry.
This is Tiffany. And I would agree wholeheartedly. As part of the effort with the statewide housing plan is truly looking at more of a regional approach, recognizing that various locations across the state have assets and unique circumstances. And so you really want to capitalize on the assets of the community and the people that have been engaged in the community to really strategize what needs to happen. I think when you start talking about engagement, is surely having individuals with lived experience at the table, not just sharing their thoughts, but helping craft solutions to the problems or the issues that are being faced. And then, and making sure that their time is valued accordingly. And then moving from there to actually bring forth resources to the table, which could be a combination of things. Could be dollars, it could be leveraging partnerships, figuring out where you have shared goals, and then working to strategize those goals into action. So.
Yeah, I think you touched on a lot of what I was going to say. I think the other thing is having an open conversation where you're not necessarily at the table. So I'll give an example. We just did a community engagement with inviting people to talk about their MDHHS concerns around like chronic disease and what we're doing in our work, where we hired an outside facilitator that was from the community or had represented the community, where we were not present so people could speak freely and not feel like they're going to feel any repercussion from MDHHS, especially if they're from an organization, or they might receive our services and are concerned that they're, people are concerned there might be retaliation. So removing yourself as an organization from it, having a third party host that conversation. And also, if you can, because they are experts in lived experience, I'll pay people. Like, we don't talk about that enough, but if my time is valuable as the expertise, I get paid to be here as a food security public health consultant, their time is also valuable. If you can, pay them accordingly. If you can't pay them, figure out another way to, in some way, show that you really value their engagement, right? And it's not just a touch point so we can collect what we can collect and get out. And then making sure anything and everything you collect, anything that comes for that comes back to them for their review, for their reflection, making sure that their input isn't, a lot of communities feel like we just take resources from them and don't give back. And we're constantly surveying them. So making sure it's ongoing and you're responding, and they get to have feedback on what before you print whatever or do whatever in the end. It's not just you get to take it and do what you want. And when you do that, you build authentic relationships, and they will continue to engage with you at will because they understand you're in relationship with them.
Thank you. So we are obviously trying to make sure things keep moving along and recognize there's been a ton of questions that are submitted. I do want to thank the panelists again for your time, and we will continue to make sure that they are engaged in getting answers to questions that have been submitted, or connecting with individuals within the department that may be able to better assist. So with that, I would like to hand the floor over to Cartier Maps with Policy and Planning for focusing in on our health equity focus area.
Good afternoon, everyone. My name is Cartier Mathis. I am the Senior Health Strategist for the Policy and Planning Division. And today I will focus in on health equity along with two of my other colleagues. To start, we would just like to say that it's our belief that everyone should have a fair opportunity to achieve optimal health no matter where they live, who they are, or how they earn money. We plan to ensure this is by funding local organizations, convening community stakeholders, and where possible, advocating for the city and other policies that improve the health of all Michiganders. Health equity is at the foundation of our SDOH strategy as we continue to use the experiences, our perspectives, community perspectives, and priorities of the people and organizations living in and directly serving the neighborhoods most affected by health inequities. We believe that by working together, we have the best chance to ensure that we all can live thrive, and be successful no matter where we live in Michigan. Health equity is at our foundation, and we also have other buckets that ploys into health equity. I will pass it over to my colleague Erin, who will give an overview of data.
You're right, the microphone is a little slow. My name is Erin Mobley. I'm the Technology Policy Specialist and Care Connect 360 business owner with the Strategic Alignment and Engagement section. I just want to briefly touch on data and the importance of having quality data to support our SDOH initiatives. So the circle on the left was shown earlier on in the presentation and depicts the ways in which social aspects of an individual's life can affect their overall physical and behavioral health. And the circle on the right illustrates the need for complete and integrated data surrounding these social determinants of health so that we can provide evidence-based programs and care to those Michiganders in need. So of course, we want to be able to provide assistance to the individual, but we need data to back that up. And we will be doing some different brainstorming sessions related to data in the future. So we're kind of just like very high level going over it today and the importance of it, but we will get into that more so in the future.
Good afternoon, I'm Alicia Brace. I manage the Community Health Innovation Region program. And as Cartier said, health equity is really at the core of all of the work that we're doing on this strategy. And it's built within each of the focus areas of housing and food security, but we also have it standalone because it's so important to us. And so health equity is the fair, just, and equitable distribution of and access to public services, social resources, and the implementation of public policy necessary to achieve well-being and thrive. It requires removing economic and social obstacles and inequities such as poverty, discrimination, and their consequences, as well as building better outcomes for historically and currently disadvantaged populations. On this slide, you can see the 3 priority areas within the health equity portion of our SDOH strategy. These focus areas were determined by input from over 600 MDHHS staff members, as well as feedback from community-based organizations throughout the state who are working to address social determinants of health in their communities. Additionally, we've worked to incorporate recommendations from the Coronavirus Task Force on Racial Disparities, the Michigan Poverty Task Force, and a systematic review of the literature on addressing health disparities in diverse communities that our Office of Equity and Minority Health had developed. So now I will turn it over to my colleagues from that office to highlight some of the work that they're doing in this space.
Thank you, Alicia. And I'm going to attempt to keep on my camera for a minute. I don't know if it is even showing yet. And if not, I'll go ahead and turn it off. So good afternoon again. I'm Brenda Jegede, and I lead our Office of Equity and Minority Health, which is one of 3 divisions within the Race, Equity, Diversity, and Inclusion Office, or READY office. And the other 2 divisions are our leadership development and our equity development. And definitely appreciate the invitation, to join the webinar and share some of our equity work that we've been engaged in within the department. A lot of what you just heard from our other colleagues. Our next slide. Oh no, this slide. So a couple of my colleagues and I from READY will share information on some of these focus areas. Our efforts have been intentional and promote organizational change activities. We are looking to increase foundational knowledge around equity related concepts We implement practices and we integrate, I should say, I'm sorry, a equity framework into our policies, our practices, and our procedures. And we do that so we can improve our ability to provide culturally and linguistically appropriate services to our Michigan residents. And then we also look to evaluate our actions and to best determine how to sustain them. So several of the items that's included here on this slide, I will speak to, or my colleagues from Ready will speak to them. We do not have separate slides to describe 2 online trainings. One is an introduction to health equity. The training helps to understand equity-related terminology and definitions. The second training is titled Systemic Racism, and it identifies how our systems, how our organizations can produce and perpetuate inequitable outcomes. We offer debriefing sessions to facilitate post-training conversations and to engage our staff in learning opportunities where there's interaction and exchanging of ideas and experiences. And both of these trainings are completed annually by our MDHHS staff. And they're also available and can be completed by those who are outside of the department. So if you're an external partner, you can access these trainings on our Office of Equity and Minority Health website. We also do not have slides to cover one of the CDC funded related programs to establish strategies to ensure greater equity and access to COVID-19 vaccination, particularly to those who have had a disproportionate effect by COVID. So we currently have contracts with 3 entities in Michigan, and those entities are looking to develop culturally relevant messaging for their communities. We talked a lot about not a one-size-fits-all, and they're also looking to hold vaccination clinics that are accessible to the populations that they serve. Next slide. Public Act 653 was signed into law in 2006, and it amended the Michigan Public Health Code, and it requires MDHHS to establish a structure to address health disparities and health inequities for our racial and ethnic populations. And the majority of our efforts within the Office of Equity and Minority Health is to address the provisions that are included in this law. And we focus on improving the health and social outcomes for 5 racial and ethnic and tribal populations in Michigan. And those are African Americans, our Arab and Chaldean Americans, our Asian Americans and Pacific Islanders, Hispanics and Latinos, and Native Americans. And in accordance to this law, MDHHS has some responsibility to, of course, monitor minority health, but also to promote workforce diversity, where those that are providing services reflect the communities that they're serving. And then we're also looking to develop policy and actions to advance health equity. Annually, we are required by law, MDHHS, to provide a report to our state's legislature and detailing our department's efforts, the impact and the continued challenges in addressing provisions of the law. Here, we see some lessons learned. Last year, our report focused on COVID-19 and the pandemic. We've submitted that report to the legislature. We surveyed staff across the department and held interviews with our executive leadership, and staff shared numerous accomplishments. There were, I can't even begin to describe, how many actions and programs were taken to address needs. But they also shared these lessons learned, which was referenced to earlier by Nina, in terms of how we can focus on advancing equity, both during this pandemic and beyond. And to no surprise, they mentioned the importance of placing equity at the forefront of all of our efforts, addressing social determinants of health, making sure we're improving our data and surveillance systems, definitely engaging with the community, and also lifting up innovative approaches and actively working, I want to say, in tandem with the community. As we heard earlier, making sure that we're listening to those recommendations that are coming from the community and those nuances in terms of how to really reach different populations. And then, of course, our need for sustainable funding. And then finally, for me, our Minority Health Community Capacity Building Program. In that program, we fund local community-based organizations. On the next slide, we fund local health departments and health systems and other entities to build their capacity to address local needs and social determinants of health. We are currently funding 5 organizations over a 3-year period. They're addressing data needs. They are utilizing community health workers to deliver culturally sensitive sexual health education and linking LGBTQIA+ adolescents to services. And they're conducting comprehensive needs assessments, which include looking at social determinants. So that'll be it for me at this time. And next, Afton will share some information on our CDC COVID Health Disparities Grant and the establishment of some regional health councils.
Thank you, Brenda. So I'm Afton Chambers, and I work in our Office of Equity and Minority Health, and I am charged with leading our response to really mitigating COVID-19 health disparities among racial and ethnic populations and also our rural communities. As a part of this effort, we are currently funding an opportunity that seeks to establish some regional health equity councils. In doing so, we're looking for backbone organizations to be the convener and the fiduciary of these 14 regional health equity councils. And so part of this work kind of goes back to what Janae mentioned previously, in that we want to create authentic partnerships. And so that means that we want to have the folks that are on the ground and that are living in the community and that are facing the lived experiences to really lead the efforts of what's happening. And so that's the purpose of really lifting the idea around these health equity councils. These BBOs that we're looking to fund are going to, like I said, be conveners and fiduciaries. They're going to support really building and strengthening capacity for those local organizations that may be smaller and may not be able to do the things to the length of and the reach that they need to. So the BBOs will basically help us in 5 key things, and that's obviously a reduction in COVID-19 disparities in our impacted communities among the 5 racial and ethnic minority populations, as well as planned reduction of community identified priority risk factors. We know that there are risk factors that existed prior to COVID-19. The social determinants of health have been amplified with the responses of COVID-19 and its disproportionate impact. Then we're looking to develop and implement, practices and policies that will promote equity and reduce those disparities. In doing so, we're looking to have equitable distribution and efficient use of resources to support those affected communities via those organizations that would be members of those health equity councils, via community leaders, both emerging and existing. And really what we're looking at the core of this is that we have solutions that are community driven, really focused on decision making and priority setting that's not at the agency level, but really sort of empowering folks to self-determine really what they think those actions should look like. Next slide, please. So our health equity councils will be located in the following 14 regions. These regions were selected because the vast majority of our racial and ethnic populations reside in these areas. So the goal is for us to fund 1 health equity council in each of these regions. As you'll see, most of the regions are counties and also include the city of Detroit. And the required activities is really to serve as a mentor organization in that BBO for that health equity council, really supporting those grassroots organizations, trying to build that capacity for their leadership and growth. Also to create some inclusive and engaging council sessions, because we want to minimize those power differentials. Part of minimizing the power differentials is that members of those health equity councils will need to be compensated for their time. Again, referring back to what Janae mentioned earlier about us creating authentic relationships. Of course, we also want those BBOs to assist those health equity councils in assessing not just the strengths and barriers in the community, but establishing goals and objectives and action plans that will prioritize equity at the forefront, and then help lead reviews of policies and practices that may create barriers or continue the inequities that exist or are those that create access to service inequality. And that's it for me. I'm going to turn it over to Yesenia, but I will mention that this opportunity is open until April the 14th.
Thanks, Afton. And my name is Yesenia Murillo. I am a senior equity analyst within Ready, and I'm here to talk about the equity impact assessment, which both Brenda Jaggedy and I co-lead. So just a little background, in partnership with the Racial Disparities Task Force, the Equity Impact Assessment, and I'll be referencing it as the EIA, just for short. The EIA process was introduced by MDHHS, specifically the Office of Equity and Minority Health, and we began leading this EIA process pilot since May of 2021. These efforts respond explicitly to Executive Directive 2020-9, which is about addressing racism as a public health crisis. As we know, under this executive directive, the governor asked MDHHS to make health equity a major goal, as well as to work with other state departments to examine data, develop plan policies, and engage and communicate with communities, as well as advocate for communities of color. And lastly, I wanted to obviously mention that the EIA is one of the top priorities and outcomes of this social determinants of health strategy. And it is also aligned to the federal government in responding to the executive order on advancing racial equity and support underserved communities, wherein you'll find section 4 and 5 make a request to identify methods to assess equity and conduct an equity assessment. Next slide. So you may be asking, what is the EIA, right? So it is a decision-making model that MDHHS is piloting with the goal of providing a concrete, organized, and more objective way of assessing processes, policies, programs, and any other decision through an equity lens. So you'll see the model to your right. We know that inequities in programs and outcomes are sometimes unintentional, and they're embedded into our government systems and operations, and they can be amplified by implicit bias. Particularly those with decision-making power have to be very cognizant of equity impact. Therefore, the equity impact assessment process is designed to respond to race equity and health equity issues by trying to reduce and ideally eliminating long-standing racial, ethnic, and other marginalized groups' disparities caused by the very systems of oppression that we were talking about, such as racism, to start with. Next slide. The EIA process, just to go a little bit deeper into it, has the following goals. The first one is to guide leaders with decision-making power, and we're not talking only about positional leaders, but anyone who is engaged in contributing to a decision that can lead to more equitable outcomes. We want to help them assess their decisions across programs, policies, practices, and any other decision-making point to produce more explicit equity outcomes for racial, ethnic minorities and other marginalized populations. The process also helps prevent or reduce implicit bias from affecting the processes, practices, and other decisions that the department is developing to serve the community. And finally, it's an opportunity to evaluate potential adverse impacts or unintended consequences prior to adopting a particular implementation proposal. Next slide. So here we have a quick snapshot. It's a timeline of sort of where we have been, where we're heading, and I'll just summarize. So there are 3 pilot areas. I'll talk a little bit about more about that. My apologies. But each pilot area has participated in foundational training, technical assistance. They've received tools to build awareness and strengthen capacity to implement equity. And some of the topics that I want to highlight include data collection and interpretation, because this is a data-driven process, and engagement of priority populations, because as Afton and Janae have been talking about, we center the decision-making with those who have lived experience. And we're also working with evaluators from MPHI and Public Research Evaluation Services on assessing this process, creating a theory of change, logic models, and evaluating the entire curriculum. We have some midterm metrics to help staff identify how their decisions contribute to disparities, and some long-term metrics to really dig into whether the intervention that they're proposing affected any change. And finally, we will publish an EIA toolkit for replication purposes toward the end of this year. And last slide. These are the 3 pilot areas that we're working with. And first, we have Economic Stability Administration. They're addressing disparities experienced by Hispanic and Latinos with visual impairments by making the SNAP Family Independence Program application process more accessible to them, both in hard copy and electronically. HACA, Health and Aging Services Administration, is proposing a policy to add Medicaid coverage for doula services to contribute to addressing the disparities that we very well know are experienced by Black African American mothers who die at a 2.8 times compared to their white peers. And finally, BHDDA is improving representation of Black and African American children receiving equitable trauma-focused cognitive behavioral therapy at our community mental health association sites. And that's it for me. Thank you very much.
All right. Thank you very much, Brenda, Afton, and Cynthia. And I wanted to open the floor back up for questions. As I mentioned, we've had quite a few questions coming in the chat and email and so forth. We wanted to see, I'm not sure if Steph White, are you still on the line?
Yes, I am still here.
Okay. Thank you for hanging in there with us and for the patience with the mute button. I was struggling with that as well. So I wanted to ask a question for you. There's been quite a few questions that are coming tying into kind of getting at the crux of like a closed loop referral system or other cross-enrollment methods. So would you be able to discuss a little bit how the state is progressing on the development of a closed loop referral system as well as other cross-enrollment efforts?
I can. Briefly, I'll say that overall, the cross-enrollment effort is, as I mentioned before, it has 2 parts to it. One is internal, where we look at the silos and the barriers that the Department of Health has put up between programs that make it harder than necessary for applicants to access all of the services for which they qualify. And we're looking at internal ways of breaking that down. For example, Christina and I worked on a project to help applicants, or I should say clients who are on Medicaid and or on food assistance and have children under 5 or pregnant women in the household to increase their access to WIC. And, we did some of the data matching work on behalf of those clients and proactively reached out to them to take away some of the burden of having to do the research and figure out how to apply. And we sent them an easy text message they could just reply 1 to, and they would go into the hopper. And then the WIC offices nearest them would take responsibility to reach out and schedule. So that's kind of an overview of what cross enrollment does. In terms of the closed loop referral system, as many of you I'm sure are familiar with our My Bridges application, which is the main portal through which people access information about programs they can apply for, they have applied for. It has the ability for us to, for our community partners to receive a referral of a client who may need some support, or to send a referral to that client to say, hey, I think, this food bank might have some support for you while you're waiting for, for example, your SNAP benefits to come through. And as it is now, it still puts the burden on the client. And again, with this program, we want to remove that burden and take it on ourselves, because we're the paid professional staff, and the people we're trying to help are, overwhelmed with the things that they're responsible for. So in this case, an adjustment to that application and changes in the technology will make it so that if one community partner, if a person walks in, let's say, to one of our community partners and says, I need help in various areas, including I'd love to find out where there's some food available, we can make that referral to the food bank for them, and the food bank themselves can follow up with the client and say, hey, I heard you're interested in getting some support this Thursday, 3 o'clock, come by. How many people in your household? Do you need kosher food, for example? And take on the burden on behalf of that client to give them the information and set things up. It also then allows whichever community partner made that referral to follow up and make sure that they got the support they needed. So for example, if you're a community partner and you're sending a lot of your clients to one particular other community group, you can pull up a report and find out like, oh, a lot of our clients are not making it there. They never got there. That didn't work out. And you can find out why and how that went. So it's just, it's a pilot project that's being unrolled specifically around the food access area. And one of, the key partner for this is the Food Bank Council of Michigan. And I think they're on this call with us today. But if that works and when we get that to work, then we'll expand it to other areas such as housing and other support areas.
Thank you, Steph. And I do want to also, there's been several questions related to the presentation that Brenda and team gave, that some of them have been addressed in the chat, but I did want to ask them, I just lost the question. Sorry about that. We provided the list of the Health Equity Council regions in the chat, and Brenda also provided a link to where folks can see that application that's currently available. Just 1 second.
So Brett, there was a question about overlap with the existing food bank councils and the health equity councils. Maybe the Ready team can speak to, again, collaboration and opportunities to really align in that space.
Thank you.
I'm coming off mute. I think I'm off mute now. This is Brenda. Yes, absolutely. The main, goal of establishing the councils is for there to be some collaboration, and we know there be a lot of overlap in terms of interest in addressing those local needs. we're really leaning on the organization that will help to establish the council and those that would be a part of the councils to know what are the local kind of set up in terms of resources to provide services to the populations there. So we look to and expect there to be a lot of overlapping relationships, collaboration. We have listed, some organizations that we believe should be considered and a part of the council. We have a few that have been identified as minimum organizations, but we're looking to help the councils. Also note if they're not aware of areas and councils and say other efforts within those areas, if we're aware of them at the state level, to make them aware of it at the local level so that they are intentionally collaborating.
Great, thank you. And I'm going to pause here and see, Nina, would you like us to move on to the next steps for SDOH?
Yeah, thank you so much, Brad. I know we only have 10 minutes left and I want everyone to understand how they fit into things. So I'm going to speak to this slide at a very high level so that Laura has time to really talk about implementation and how you can continue to engage with the strategy and guide where we're going. So on this slide, we're looking at what are those additional social determinants of health domains that we need to explore. And so we've talked about, again, the focus for 2022 has been housing stability, food security, and health equity. And there's a lot of work to do within that space. I'm really excited, and I love the conversation that we've had about the intersection between housing and food and where we can go with that. Like Janae mentioned, all of these domains are interconnected, and that's what we're really looking at in this space is how do we bring these things together as we move towards holistic approaches to supporting community-driven solutions. So in 2023, again, we'll continue to look for those intersections. We'll also explore closed loop referrals, as Steph mentioned, through a number of different pilots that will allow us to look at what the existing infrastructure looks like, how we can standardize things without, informing what a community has to have in place. As state partners, we want to make sure that we're able to utilize what tools community may already have and make sure that there are norms so that we have system interoperability so that the systems are talking to each other and so that we're able to transfer that health information, that social information back and forth to really make sure that that client gets a comprehensive resources to support their needs. And so with closed loop referral, community information exchange and health information exchange, like I mentioned, there'll be a number of pilots that we will be evaluating and looking for, again, those standards and best practices. Regional collaboration is key. I cannot stress enough that we are not looking to develop something that we feel like this is what communities should do. There's no one size fits all here in Michigan. We know that there are needs based on community. And so we want to develop mechanisms that allow us to be informed and have policy and resources allocated that's flexible and allows communities to do what they need to do to address the concerns in their area and not be a barrier in that space. Community health workers are integral to the work that we do, and they've done so many things. I think there's an opportunity for us to look in terms of expansion of the role and also how we better support them as state partners. So there's a number of things that we can do. One more thing I want to highlight, because it should be on everyone's radar. We are getting a huge influx of infrastructure funds. We need to have a health and equity lens to how we approach utilization of that. And that's where, again, this strategy looks at how do we align across all sectors? How do we develop approaches that get us to healthy outcomes in community? So there'll be work done in that space that I'm really excited about that will, again, interconnect with all of these domains. Next slide, please. So next, Laura's going to talk about implementation, how all of you can plug into it. Laura, I'm going to hand it over to you.
Yeah, thanks, Nina. This is the exciting part for me to talk about implementation of the strategy. So one of the big ways we want to move this work forward is really through meetings similar to this, where we're going to have quarterly updates on initiatives in the strategy, and just kind of provide an overview of what we're working on and looking ahead. And then we will also be posting those updates. We've got a website, and we'll share a little bit more about that later. And a newsletter and other ways that we can kind of continuously share the work that's ongoing with the strategy. We will also be having action teams that'll be part of each focus area. And earlier kind of mentioned that we'll be having these kind of monthly meetings within each focus area to really frequently, meet more frequently to really hammer out the details of the strategy. Also, another way that we're moving this work forward is by establishing a social determinants of health strategy steering team. So we'll be having leadership and subject matter experts that will really help guide the direction of the strategy and ensure that we're adapting to those emerging trends and continuing this work with that in mind. We will also be establishing an SDOH interagency work group. And that'll be across state agencies. So we'll have representation from each of the departments and really be taking that health and all policies approach that Nina discussed earlier with the health equity lens. And we're really hoping to have that kind of established and up and running with a regular cadence by June. So I'll also discuss, we've got some engagement opportunities. We appreciate everybody being here today and would love to have everybody continue to stay engaged with this work as the strategy continues to be implemented and expanded. So one of the ways that you can do that is by signing up for our Social Determinants of Health newsletter. So right now, I think Erin will be dropping the link to sign up for that in the chat. I know most of you signed up for that listserv when registering for this, so you can expect some regular updates through that newsletter. We'd also love to have you join our ongoing stakeholder meetings. So those are kind of those monthly focus area stakeholder meetings. I'll talk about those a little more in detail in the next slide. And you can sign up for those. We'll kind of share those as they get scheduled through our newsletter and through our website. We send out surveys pretty frequently. We will be sending out one after this meeting so that you can continue to provide feedback. We really value that input that we get after these meetings and really like to kind of sit down and look at that as we continue to develop the strategy. And then finally, you can visit our website, and that link will also be dropped in the chat. It'll be michigan.gov/SDOH. So if you go to the website, right now it's just kind of a basic landing page that we've got established with some information about the strategy, but we will continue to build that out and include a lot of toolkits and resources and post dates for meetings and things like that, and hope to have that built out into a great resource to continue to collaborate. So I also wanted to talk about some upcoming key dates that we have related to the strategy. April 5th, today, we are launching the strategy today through this webinar. And then pretty soon, next week, we've got our first housing stability stakeholder convening. And then in May, we've got the food security stakeholder meeting. We are still establishing dates for our future meetings, but we will be getting the health equity brainstorming session on the calendar, as well as a dedicated meeting to discuss more about the social determinants of health data strategy. And again, we will be sharing these dates and ways to sign up to attend through that newsletter and through our website, so you can kind of keep track of when those will be held. So with that, I just wanted to hand the presentation back up to Nina to kind of wrap us up and finish up.
So we have been talking at you guys for quite some time, so I'm just going to pass through this slide and I'm going to hand it over to Brad to see if we have any last minute questions that we can answer. Keep in mind that we will be creating an FAQ document, so all of these questions will be answered. But is there anything that we want to discuss right now before we wrap?
Thanks, Nana. I think one of the questions that bubbled up was getting to the topic of how the strategy is meeting residents where they are. Do you want to maybe touch a little bit about that?
Yeah, I think our presenters have done such a great job of talking about how our program areas are doing that. But as a strategy as a whole, what we're saying is we want to support community-driven solutions, and that means building trusted relationships so that so that the interventions that are developed are informed by the community. So there'll be a number of ways that we're able to do that. Brenda has mentioned the equity councils that she's developing. There's other systems that we're going to be developing and making sure that we get this two-way conversation going. So I think the first way is just, establishing that we want more community representation in meetings like this. We have all of our stakeholders here that are invested, and like Janae said, being paid to be here. We want to hear from community residents. So we want to invite them to the stakeholder meetings. We want to create spaces within community. We really want to build those and establish those channels. So more to come in that space and how we do that. But I will say up front, we have a multitude of ways that we are meeting residents where they are and making sure that we are informed by what they need.
Thank you. With that, I think we're pretty close to our time here, so I don't know if you want to pull one more question or. Oh.
Oops, sorry, let me do a wrap up because I feel like we missed something here. We have a name for our strategy. You all probably received a link saying, hey, vote for your name. We have some very great names. We have, based on what you have selected, we are now launching Michigan's Roadmap to Healthy Communities. So I hope this meets your expectations because you voted for it. We're excited for it. I hope that you all take an opportunity to review the comprehensive strategy. It's 70 pages. I know it's a lot. Maybe start with the Reader's Digest, see if there's areas where you want to take a deep dive into it. But again, that's the place to start. That's the foundation. And then engage in these stakeholder meetings. We want to hear your voice. These are not intended for us to speak at you during these stakeholder meetings. We have breakout sessions. There's discussion. You are really guiding our next step. So really excited about that. I can't stress enough that we want your voice at the table. We want to hear from you. And I'm just so excited on where we're going to take this strategy. So thanks everyone and have a great afternoon.
Thank you.